Welcome to Mazars Healthcare Digest, episode 14. We are focusing on medical group performance today and specifically strategies to avoid or reduce provider burnout, which is plaguing the industry, especially in a post-COVID world. I'm David Turner, director of the transformation group with Mazars. With me is CJ Ehrentraut, who's manager of transformation group as well. Overall, the way to reduce provider burnout is really to engage your providers, to include them, to involve them in decisions involving how they provide their care. We are going to go over survey results around provider burnout, and also we're going to touch upon just a couple of areas to focus on where you can improve your operational performance. There are many other ideas and strategies, but today we're just going to focus on a few of them listed on the screen. So survey after survey, we know that provider turnover is expensive. The AMA reports MD turnover costs about $500,000 to $1 million a year per provider, from lost revenues, having to recruit, loss of patient loyalty. In fact, the 2018 report from Eric Hawkins, their survey talked about, this was pre-COVID, physician workforce, almost half of them were already planning to leave organizations for another employer, seeking the greener grass on the other side. The reason why was 70% said that they felt disengaged. Again, we're focusing on engagement here. Ironically, administrators felt quite the opposite, with only 35% feeling that the engagement was a problem. 1 in 4 stated that there were no programs to even deal with physician and provider burnout. So in addition to wellness programs, which focus on the mental health and well-being of providers, what are providers really looking for when it comes to operations? Their day-to-day is overwhelmed with data, coming from them from all various points of view within the EMR. They want to get out on time, stay on time, so they can get home to their family and really take care of their personal well-being. Their documentation burden often requires them to work outside of their normal work hours in the evenings. And they do this because they're worried about bad patient outcomes. They obviously care about their patients, and just the overload requires them to just put in all that extra effort. And finally, providers are really worried about their income. And so, any compensation that's tied to volumes or performance really provides some anxiety to them. So we're going to focus today, again, on a couple operational ideas, going back to root causes. CJ will begin these discussions. And again, you need to engage your providers to really make this work.
Awesome. Thanks, David. So, as you mentioned, there's a number of items you can focus on. The first one we're going to focus on is their schedule. When you think about burnout, you think about how a provider can be burnt out. One of the top things that should come to your head is their schedule. Their template really is their entire day. And if there are problems or kinks that happen, it can lead to late days, late nights. So one way to combat this and make sure that you're in a good position is to take a 3-pronged approach and have your administration, the provider, and IT all come together. And why that's important is, the administration can focus on the big picture. They have the data, they've looked at it, they know that the cancellation historical rate, they know the no-shows that happen for different visit types. Then you have the provider, who always should have a say in what their template looks like. And then IT, to make sure that the system you're using is being used to its full capacity. You're getting everything out of it to help the scheduler and to help the provider get those slots filled. You want to do this on a periodically throughout the year to make sure that, the seasons, it makes sense for this sort of visit type, in the fall, spring, summer. You want to make sure that, you're not overbooking it into a slot. I've seen some in the past that providers really want their book of business to be big, that they want to build their practice up. And sometimes this can be a problem when all those patients actually do show up, and then it ruins the entire day. So like I said, have IT, admin, and providers come together, do this often, and make sure it's patient-centric to where you are allowing patients to have the access to the doctor, but also keeping in mind that providers can get burnt out if you get overzealous and start overbooking too much. David, anything to add there?
Yeah, I mean, this is really foundational. This has to be ongoing reviews. You can't have patients waiting excessively. Otherwise, they're focusing on the waiting and not on the care. And that's ultimately what they're there for. Same with the provider. If the patients and the provider engage with the care, then the outcomes and the frustration will be improved.
Absolutely. The next topic we're going to go into is that the pre-financial clearance piece. So this, should start happening, right after scheduling. Depending on how far you schedule out, you want to make sure you're starting this 2 weeks to a week out. And I'm gonna label these the business items, right? You want to handle all the business items before the patient actually gets to the visit. That way, it's maximizing the time so the provider and the patient are focusing on the health and using that time not to discuss these business items that should be taking place way before. And some of these items are collecting and updating demographics, making sure the insurance is up to date, collecting any co-pays, talking about where to show up if there's multiple locations, what to bring with them, how early to arrive. And if you're doing this, the whole day goes smoother. It's not, there's no blip right then and they're waiting to, at the front desk to handle some of these items, and it pushes everybody's day back, and those schedules, it just, once the first domino falls in the morning, it can push it all the way out through the evening. And, I'm going to hit on this, and we're going to hit on it later, but use technology and RPA as much as possible. Don't have items that can be done through automation handled by a person to waste the time. We'll talk more about that later on, but this is some of these items, they're key for using RPA technology. David, anything you want to add here?
Just, if they stay on time, then the end of the day is more manageable for taking care of. The follow-up items related to patient care. Again, focus on patient care, they're less frustrated, and that's what we need providers to really be focused on.
Absolutely. Now I'm going to hand it back over to David to talk about a couple items.
Yeah, so we've talked about the patients, being prepared, they're showing up on time, their appointments are optimized. The next thing to optimize is the patient information for the provider for the day that is in front of them. So what is the old school called chart prep, and doing this in advance is vitally important so that the provider can focus again on what is in front of them, which is the patient. So making sure that if there was any consultations that were completed, that information is in front of them, ready to go. They have their labs, their x-rays that were completed or not completed in front of them. If there's medication refills that need to be put back, ordered to the pharmacy, that is completed in that visit, and not the patient calling back afterwards and using up valuable time. Making sure the right appointment is set up, ready to go. So the provider is really focusing on not finding information, but focusing on the patient in front of them. That will allow workflow, and also it will help with patient confidence if they feel like the provider is prepared ahead of time. CJ, anything to add on this one?
Yeah, I love the blue text here. It says to be 3 days in advance. This can go, being in advance and all this, items that have to be done is something to focus on. And this one is 3 days. Sometimes it's, it can get down to 2 days out, 1 day's out. Make sure you're identifying this, making the time to get out again in 3 days. Just because you have your day-to-day business happenings you're doing on, you're not focusing on it, and it's easy to slip into that. I missed on the 2 day, I missed on the 1 day. Just make sure you're focusing on being 3 days out.
Yeah. And the next thing, again, we're focusing on, making sure that the provider is ready to go is what is called team huddles. And I know a lot of organizations have adopted this, but how to really do it well is to really allow the provider to be the captain or the quarterback of his team. So these are like 15, 20-minute meetings ahead of time with the support staff to review who's coming in, what equipment they're going to need, supplies, review even the lengths of the visits. If it could be some are too short, some are too long. If they're too long, then you could probably add another appointment. If they're too short, they're known as schedule busters, and it really provides, it really interrupts the workflow of the day. It's important to dedicate the time to these types of advanced planning.
Yeah, this sets the tone for your day. You have your supporting cast that has done all the work on the outside. Your scheduling team, your pre-financial team. This is that doctor, to David's point. He's quarterbacking, setting his day up right, and it just sets the tone for a successful day.
So finally, we're talking about RPA technology again, and from this perspective, we're looking at reducing poor patient outcomes. RPA technology can be used to comb through the data that comes through on a day-to-day basis, identifying, patients who may have fallen through the cracks because they no-showed and no one had followed up with them to reschedule their appointment. It can identify patients who need to come in for appointments, whether it be wellness or immunizations or screenings, or, there was a patient event that is related to a high-risk type of patient. They visited the ER, urgent care, they had a diagnostic test completed. The system will identify them and even make a reach out to them to see how they're doing, maybe schedule an appointment, all trying to reduce the anxiety of providers and worrying about the patient care.
Absolutely. And you'll notice that we've hit on this item quite a few times already. It's the future. You might not know what can be automated or what not, what can't be. It's just making sure that you're actually paying attention to it, so you can start having the discussions within your team and have outside help if you need to see what actually can be automated. But this should be on the minds of all administrators throughout the country, to take items that don't need a human intervention. It can be automated.
So, we want to identify that administrators do want to help, but they're so tied up with day-to-day challenges. From staffing turnover to billing questions, they have EMR challenges on a day-to-day basis, patient complaints, they have to deal with, regulatory readiness, reporting, management meetings. They want to help, but they don't have the time to dedicate to this. And that's where Mazars can come in. We can come and assist and collaborate with the management team to find the operational improvements so that providers are not getting burnt out.
Absolutely. As you focus on this slide, we're really a one-stop shop from A to Z with any problems. We work with our clients on all the items that we've talked about and much more. As David pointed out, we realize that you probably don't have the bandwidth to take on all of these extra, outside duties of your day-to-day operations. And that's where we can come in and help you. We have clients that we work right beside, and improve processes. David, anything you want to add here?
Yeah, I would just highlight again that we're former skilled operators within the medical group industry, so we have the background and experience. We're going to tailor-made anything that we identify as potential opportunities, and have an RPA technology group who can help with what we've been talking about here, including other areas around payer provider contracting. We have skilled experts in coding, developing dashboards, and even comp plans to make sure that you're in compliance with your comp plans.
So this is David and I. We really appreciate you coming to listen to our presentation today. Even if you come away with one item that piqued your interest, please feel free to reach out to us. This is our contact information. We would love to brainstorm with you and discuss how we can be a problem solver for you and your organization. Thank you.